Really around COVID-19, we want to ensure that families establish and maintain breastfeeding both at home and right after delivery in the hospital. According to the World Health Organization and the Center for Disease Control, there is no evidence that suggests that COVID-19 is in breast milk. So to date, it has not been found in breast milk according to our resources. It's also important that that families who have been exposed and delivering moms who have been exposed to COVID-19 practice practice respiratory hygiene and hand hygiene when they're in the hospitals. We want to make sure that babies and mothers have limited separation when at all possible. And there are protocols that hospitals can put in place. The Center for Disease Control suggests that informed decision making is made and that those decisions are left to the families when families are have had some exposure to COVID-19. So there are precautions that can be made when a mother wants to breastfeed and has been exposed, whether that's hand hygiene or respiratory health by covering one's face and one's mouth. We know that during an emergency, breastfeeding is the most reliable and safest form of infant feeding. We've had examples of this. Throughout Katrina, there were tragedies where families could not get to infant formula and breastfeeding behaviors had not been established. And we lost children because there was no infant feeding method available to them. Right now, during COVID-19, we are overwhelmed by the amount of empty and barren shelves that we see when we go into the stores. And we want to be sure that families know that breast milk is safe and that it's a reliable infant feeding method. And we just really believe that we need to do what we can to reduce harm. And we understand that there is no evidence that suggests that COVID-19 can be found in breastfeeding. We have a warm line. It's 1-800-313-6141. Be sure that you really understand that we are in a state of emergency and that we need our babies to survive and thrive, and that breast milk is the safest and most reliable form of infant feeding during an emergency.
Sister Friends Detroit was developed as an initiative with the Detroit Health Department to address barriers to care for women that are pregnant and live in the city of Detroit. We was looking at some of the reasons why our infant mortality rate was so high. It relates to the quality of the prenatal care, social isolation, environmental stresses that causes our babies to be born too early or at too low of a birth weight. So as a result, we modeled after an international program that is in 96 different chapters that is looking at how do we work with pregnant women differently. So what we have done is we recruit Sister Friends, who is a mentor. And that mentor is trained and is matched with a pregnant woman. We recruit women as soon as they know they're pregnant, and we match them with a mentor. And that mentor is a person like you and I that have time, have compassion, and really want to be assistant to another person, particularly a pregnant woman who may be having stressors and need that additional support. We understand even now how important it is and how difficult it is to be in social isolation, because with COVID-19, we are really experiencing even more isolation than we did prior. So that's why this program is even more important, that we reach out to our pregnant mothers and families to make sure that they have resources. So what we are actually doing is recruiting volunteers, training those volunteers who provide emotional support and help these mothers to break down barriers to resources, making sure that they have somebody to call. This program provides resources and support. We provide education and enrichment classes. And all of these classes used to be face-to-face, but of course, in COVID-19, we are all virtual. The mothers are assigned to a community health worker that walks them through the entire pregnancy up until the child is a year old. For those situations where there's complex needs outside of community health worker, we have 2 social workers that are assigned. We provide lift services to all of their prenatal appointments and the enrichment classes that we offer. This program is free to any woman living in the city of Detroit. And the only requirement is that she's pregnant and she wants to be involved. If you are pregnant, or if you are a volunteer that want to become a mentor to a pregnant woman, we ask you to call 961-BABY. Or if you just need resources in general, if you are not pregnant, but you need resources in general for your family, call 961-BABY. We are there to assist you. And again, all our programs is now virtual.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.